Doctors of Reddit. What is your most, oh my god, what is that moment while treating a patient? Story 1. My mom is a nurse and has seen some pretty messed up things. The one story that sticks in my mind involved an elderly man who came into the hospital 3 times a week to have a growth on his face washed and redressed. The growth had slowly taken over the left-hand side of his face, so much so that his left eye, his only working eye, had closed over. He was effectively blind. This meant that his wife, whom he had been looking after for years due to her frailty, was now tasked with looking after him instead. Furthermore, this bloke was old enough that the hospital didn't want to operate on him. So the hospital visits stopped. He could no longer get there, so instead, a nurse would visit him 3 times a week. Now this growth was unsightly, wept constantly, and smelled bad. Really bad, the whole house stank of it. The nurses said it smelt like death, and thought he was going to die any day. During one of these visits by my mum, she was cleaning his face over the sink and noticed a flap of loose skin. She went to clean it with the sponge and sculpsh! The growth fell off into the sink, and it was crawling with maggots. The sink was now filled with dead flesh and maggots. And the smell. Oh goodness, the smell. Turns out a fly had laid some eggs on it at some point, and they'd hatched and started eating all the dead flesh in the growth until it fell off. And the man? He was fine. There was new pink skin where the growth had been, and he could see again out of his left eye. Gave him a new lease on life. Heartwarming story? Yes. Most disgusting my mum has ever told me? Hell yes. Story 2. This was in med school, dermatology rotation. I got to see my own patient. So I asked what the problem was. He told me he thought his genital warts were back. I asked why. He didn't say a word but turned around, dropped his pants, spread his butt cheeks, and showed me a cluster of genital warts around his anus at least 10 centimeters in diameter. Even when he stood up straight, it was just sticking out of his buttocks. I put up my most professional voice to say, yes, I think you're right. The man thought this was hilarious. I'm not sure if I've not seen more surprising things after this, or have just gotten used to them. Story 3 smelled what turned out to be an infected Bartholin's gland which secretes vaginal lubrication. I've witnessed childbirths, trauma surgery, and worked as a nurse's aide for years before medical school, and this was the only time I've almost puked in a patient's room. The smell was the most terrible thing I will probably ever be exposed to. Edit. Wow, thanks for all the karma. I guess it's karma coming back around from having had to actually experience it. Regardless, I actually felt incredibly bad for this woman, as well as any of women recounting their tales here. Human suffering is human suffering regardless of how gross it is. May all your vaginas be blessed with a balanced pH and free-flowing Bartholin's glands. Story 4. OBGYN rotations, I was delivering my first baby. It was an older lady from the rural side of town. When I asked her to push as the baby had fully crowned, a wad of worms exited her anus. I'm talking at least 60 live worms. I gagged so hard but managed to keep a straight face throughout and deliver the baby. I realized then and there that OBGYN was not for me. Story 5. Paramedic here while working in the ER one night, we had a guy come in complaining of groin pain. So we bring him back and it turns out he has a master lock, the kind with the spinning dial that you use to secure your locker at school, locked around his pens. Essentially, blood could flow in but could not flow back out, so this thing was hugely swollen. He had panicked after he realized he could not remember the code, dealing with a real genius here, and he took a screwdriver to the dial and snapped it off. So we consulted with urology, and the urologist wanted to take him to surgery, cut his ween lengthwise, slide the top out, then the bottom, and then suture it back. Needless to say, the patient wasn't thrilled with option A. So option B was for this big nurse, we'll call him Tom, to go in with bolt cutters and cut it off. Option B selected, curtain closes, Tom gives a 1, 2, 3. A loud scream at 3, a pop noise, Tom exits with a broken lock, and the man was sent to the floor to recover. That's just one of so many, but I always tell that one. Story 6. I am a surgery resident. I once helped operate on a man whose face was chewed off by a bear. I had to find little scraps of skin at the edges off the hole in the middle of his face and try to decide where they went to try and make the damage smaller. I also saw a patient come to the emergency department with a Barbie in their rectum. He apparently puts the arms up and legs down like a diving position, rubber bands the arms together, then places it in his rectum for a time. When he wants it out, he takes laxatives. Only this time it got stuck. The kicker. When we removed it, he asked for it back. Story 7. There used to be a well-known patient that would present to the emergency department with frequent urinary tract infections. Now, urinary tract infections are much less common in men than in women and don't occur sporadically that often. This gentleman was a male stripper, and his part trick would be what he called a ruby shower. In essence, he would empty his bladder and replace its contents via a catheter with red wine. He would then empty his bladder during his performances. Unfortunately, fate caught up with him. One infection became too severe and he did not survive. Story 8. Surgical registrar here. I was working in a smallish hospital in a rural town in Australia. We were asked by the medical team to see a patient that had been admitted under their care by the emergency department overnight. Happens quite often in that hospital. With a CT demonstrating a very distended bladder. They apparently had trouble with a catheter, so they called me to have a look. With much hesitation, I went up to see her on the ward. So I managed to put the catheter in with a lot of trouble. This lady was fakely incontinent. A little bit of urine drains out and I just keep thinking, something's not right. I go back and look at the CT scan, and the IDC placed in the emergency department looks like it's appropriately positioned, subsequently pulled out. Behind it was one big of a uterus, absolutely full of what appeared to be a fluid density. The report read, along these lines, IU not, as follows. Conclusion. There is a very distended bladder. The catheter balloon is situated in the prostatic urethra. Moderate to severe hydronephrosis is noted. Long story short, I speak to the consultant. We get her to theater. With great difficulty, we manage to dissect our way around this huge uterus, and we call the O&G guys to come and help get it out. Unfortunately, during this process, the uterus bursts, and there is a boatload of pus that just streams out. It smells so horrible. There are people gagging around us at this yellow-green sulfuric-smelling goo. The scrub nurse can no longer take it and vomits in her mask. The consultant is looking at me like, fuck you for bringing this to theater. We finish this case and I am so glad. I get home and I keep thinking, I can still smell this awful thing. I have another hour-long shower. All night I can still smell this thing. Morning comes, I can't have breakfast because I can still smell it. I get to the hospital and everyone is wearing masks. Apparently the smell was so horrible, and the extraction in our theater so outdated that it had somehow pumped the smell into the vents around the hospital. All night, small amounts were leaking out into the atmosphere, causing this horrendous smell. Silver lining. Lady lived for another 3 years. TLDR, I operated on a lady with a huge uterus full of pus. Consultant hated me for the rest of the year. Edit. To all the people pointing out that women don't have prostatic urethras, I'm well aware. That was the whole point. The radiologist was very embarrassed and apologetic when I called him to amend the report. Story 9. My friend's brother, who is a surgeon, told me lots of WTF stories, but my favorite is this one. More funny than gross. While a student doing residency at Anonymous, Major Knot RPH or Joondalup Hospital in Perth, Western Australia, a patient was admitted through the emergency department because he and his boyfriend had been playing a kind of game where they each stuck a balloon on a straw up their urethras and took turns to blow into the straw, which apparently gave them an OMG need to pee feeling and a fit of the giggles. But this time, said patient had laughed so hard the straw came out, leaving the partially inflated balloon behind. The docs tried a few things to pop the balloon, but couldn't quite get at it, so they decided that a quick keyhole and camera into the bladder to puncture and remove the balloon was the only option left. The keyhole went fine, and the balloon was easily deflated and removed, along with many other fragments of variously colored balloon material. My buddy's bro said though maybe 10 or 12 balloons had popped in this patient previously, leaving fragments in his bladder. It wasn't the first time this boy had lost a balloon up his yar, but it was the first time it had been full of air when he lost it. TLDR dude lost multiple balloons up his playing games until one day one twisted off while blown up. Surgery ensued. Edit. I have to say, some of yous cunts need to chill the out. Yeah, it's a story I heard from a guy. It might not be true. It might be partly true. It might be an Australian med student's urban legend. That doesn't make me a fucking liar, as 1PM put it. It makes me a storyteller passing on a story I heard. I think I made that clear at the start of my post, but if not, here it is again. This cunt. I know once told me this story. Edit 2 removed the exact hospital name on Advise Edit 3. Yeah, it is probably just some bullshit. Use negative, mostly American cunts don't seem to get, like I fucking already told yours about 5 fucking times. It's a story my mate's brother, who cuts cunts up for a living, told me this one fucking time. I don't know if it's exactly fucking true. I wasn't there, you headed fucking Yanks. Jesus fucking camel crotch. Christ, just enjoy the story. Especially since used cunts gave us Paris fucking Hilton and Kim fucking Kardashian slut. Edit 4. My apologies to almost all US American Redditors. Please know that I don't count you amongst the nuts I am interwebs shouting at. Some of my best friends are, formerly Australian, Americans and their families. Story 10. So, the birth of our second child. My wife and I decided to go with the home birth option. Long story short, she was in full labor, dilated, and starting to push, but her waters hadn't broken. The midwife who was there said it was no problem. So my wife is lying on the ground and I move into position to catch the baby. She starts to push and her waters burst, except instead of clear fluid I and now being liberally saturated in bright green fluid. It turned out my son and pooed during the labor, and this was mixed with the amniotic fluid. So my eyes are the size of dinner plates. This liquid is pooling around my knees in something that resembles a scene from the original miniseries of V. And I am not entirely sure what is going to be birthed, human or reptile. Luckily, the rest of the birth went fine, and my son arrived into the world less than a minute later. I'm saving this story for his 21st. Lots of comments about the pros, cons of home birthing here. Hey, that's why I'm on here to get others' points of view. So I thought I would provide a little background on why we opted to do it this way. Prior to us having kids, my wife had gestational trophoblastic disease, cancer, and spent a lot of time in hospital getting chemo to treat tumors that had spread into her lungs and brain. Chemo to the brain via spinal taps are not cool. At the worst of it, she probably would have had only 6 months. She had the highest tumor marker levels they had seen in a GTD patient to live, but luckily GTD responds very well to chemo, and the oncologists here in the public health system are outstanding. So put simply, hospital was not a happy place for my wife. We discussed having a home birth for our first, and while my wife was keen, I wasn't since it was our first. So our first child was born without drama in hospital, and we were back home within 8 hours. Our choice, wife and baby, didn't get any sleep on the ward, where we were all much happier. Our midwives, there are always 2 midwives and we had the same for both, had 20+ years experience and were happy to deliver at either home or hospital. We live close to the hospital and the ambulance dispatch is 500 meters down the road, so help wasn't too far away. Also, the midwife wasn't overly concerned by what had happened and seemed to have everything well in hand. Yes, we accepted that there was some slight risk involved, but we also knew that the more relaxed and comfortable my wife felt, the less stress there would be on the baby and also on her. If we were to have another, would we home birth again? I am sure my wife would be keen. I am more 50-50, so a tough call? Story 11. Both my parents are doctors. Nothing seems to have really shocked them except for patients brought into the ER who were in motorcycle accidents. They wouldn't go into detail, but briefly said that if you're not wearing protective clothing and you get dragged across the road, it can do horrific things to your skin. And more specifically, it can do absolutely horrific things to men's nether regions. As in, what is that? What goes where? What did that used to be? And what's even worse than your penis and testes being ripped in half or ripped off is that they use what are effectively metal scours on the wounds to get the gravel out. I'm not even a boy, and that makes me wince. Story 12. I was working as a scribe when we went to see an 8-year-old girl that had a fever. Nothing too remarkable until we started the physical exam. We examined her head. Normal. We examined her upper extremities. Normal. Then we pulled up the blanket to examine the lower extremities. Her feet were the size of an infant's. You should have seen the look on the doctor's face as he was trying to figure out how the girl's feet got so small. The mother looked up at the doctor, saw the look of confusion on his face, and said, "Those aren't her feet." She pulled up the blanket a little further, revealing a pair of perfectly healthy feet, nestled next to the feet of a doll that she put under the blanket. We saw the doll's feet and thought they were the girl's. Edit. For those wondering, she had the flu. She turned out fine. Story 13. I'm not a doctor but a med student, fourth year. I had to take off a shoe from a hobo with diabetes. The most terrible smell you can imagine times a billion. Searched for the foot after I pulled the shoe off. Found the tip of the foot in the shoe on the ground. Blacked out. Edit. Oh, I meant foot, not food. D. Edit 2. Most of you think that the situation was like this. Believe me, it wasn't. Story 14. My dad is a nurse. I have asked him this question before. And most of stories are about people who come in with deodorant cans up their butts and try to claim that they were climbing into windows and fell on the can or something. But there is one story which he has told me which really stands out. When my dad was in his mid-20s, he worked in the emergency department of a hospital. One day, this morbidly obese lady comes in complaining of abdominal pain. They start to look her over. Everything was going fine until they decided to look in the folds of her gigantic stomach. When they smelt this horrible smell, they found a decomposed chicken wing covered in maggots which had started eating at part of her skin. Yum. Story 15. Well, I'm not a doctor yet, but here is a story from one of my professors. This was in rural Alabama. This middle-aged married couple had presented to the ER after they had been drinking for almost the entirety of the evening and got into a heated argument. Things got heated, and the woman eventually fell off the porch of their trailer into the shrubs a few feet below. The husband, in his drunken state, suddenly dropped the argument and came to his wife's aid. She didn't suffer anything too serious, just a couple of scratches here and there, except for what the man said looked like a piece of glass or pipe or something that became lodged in the woman's arm when she hit the ground. He decided to not come to the hospital because he could remove this object himself. He got his largest pair of pliers and gripped onto this glass pipe-looking thing lodged in his helpless wife's arm. He clamped down and pulled, cranked and cranked, trying to remove this object, and it wouldn't budge. After his masculinity defeated and the alcohol wearing off on both of them, they decided it's sensible to finally come to the ER. Upon arriving to the ER, the doctor immediately realized this poor woman had a compound fracture of her humerus, and this pipe or piece of glass thing was her bone sticking through her skin that her husband was trying to pry out with a pair of pliers. True story. Story 16. I recently spent some time working in the operating department, and one day we had a giant inguinal hernia. At this point of my experience in hospital, I thought nothing could surprise me. Dear Lord, was I wrong. The patient had mental health issues, and we got him on the table, knocked out with anesthetics, and pulled off his gown to take a look. His scrotum looked like this, NSFW. We did an open surgery through his abdomen and spent hours pulling his intestines out of his ball sack. Basically, the guy's abdominal wall broke through and allowed his intestines to slowly fill up his scrotum. But this had been going on for years before he got it checked. TLDR, guy had his intestines in his ball sack, looked like this. Story 17. Story from one of my friends who worked as a paramedic in Hamburg for some time. Mind you, this is disgusting. They were called to an unconscious person, drug addict, who was slumped down on a park bench close to the train station where back in the days the most drug addicts would hang around. They approached the guy and tried to wake him up, checked his vital signs, etc., then put him on the ground. He had no shoes on but only wrapped up his legs in plastic bags. If you ever been around hardcore drug addicts, you know, most of them don't smell too good. After a while, they just give up on personal hygiene, which incidental is actually more dangerous than the drug itself since they tend to not treat their scabs, etc. This guy reeked to high heaven, and once they proceeded to check his plastic bag shoes, they saw why. His legs up to his knees were completely black and full of maggots. He had an infection in both legs due to shooting up heroin and never treated them. Very much like the picture of the homeless guy which is circulating the net. Not going to post that here. My friend said that once they lifted the plastic bags up a little, which were melted into his decaying flesh, little mountains of maggots would fill around his feet. Hands down, one of the most disgusting things he has seen. Story 18. My dad is a doctor, an internal medicine physician, if that means anything to anyone. He told me this story once of when a young man, late teens, came into the hospital with a question about a condition he was having. He said his pubic region was itchy and uncomfortable, so my dad asked him to remove his pants so he could try to identify the problem. Now, since the guy was African American, my dad had quite the WTF reaction when the man pulled down his pants, and his pubic hair was white. It turns out the guy had gotten crabs from his lover, and the little bugs had laid microscopic eggs in his pubic hair, making it look white. The mental image still gives me the chills. Story 19. Imaging tech here, so I basically look at black and white images of people's innards. Once I had a guy, and it looked like his abdomen was filled with fluid, but it looked very odd. Then I realized the fluid was moving. The guy had the biggest aortic aneurysm I've ever seen, so big I couldn't measure it on my machine. He got sent off to the hospital. I was in outpatient services that day, and I don't know what happened to him. I also had a woman with so many holes in her heart, in the muscle between the heart chambers, that it was like Swiss cheese. Another time I was in a prison scanning a con. He'd been shot and all of his abdominal muscles were removed. He wore a Velcro girdle to keep his stomach in place. I put my scanner down on his abdomen, and I had to figure out what organs he was missing because he had some removed from after being shot, but he had no clue. I think he was missing a kidney, the gallbladder, part of the liver, and like half of his pancreas. Story 20. I interned in a city that gets very cold in the winter. Homeless people who were having a tough time surviving outdoors would come to the ED to get admitted, even if just overnight. They'd get a warm bed, a few hot meals, and a cleanup. This one fellow was in really rough shape. Couldn't walk. The poor nurses did most of the cleanup. Delousing, sponge bath, dressing the open sores. My job was to do the physical exam, including the mandatory rectal. Literally had to lift that scrawny flap of a butt cheek and pick the encrusted dirt, feces, matted hair away from the rectum to expose the anus. Thankfully, I only had to turn 180 degrees to reach the sink that I dry heaved into. But before this fellow can be discharged, he needs a podiatry consult. His black gnarled feet have thick yellow big toenails that have grown in a circle and are now piercing the bottom of the toe, the reason he can't walk. Podiatrist intern comes in, starts a foot soak, and proceeds to tackle those nails with something that can only be described as modified tin snips. Now you know how some people have that habit of opening their mouth when concentrating really hard? Yup, he clipped that nasty nail and it flipped right into his mouth. We shared the sink. Story 21. I'm not a doctor, but a couple of years ago I was talking to my dentist. She was complimenting me on my sparkly white teeth and healthy gums. I mentioned something along the lines of, I could never be a dentist. I couldn't deal with those who have bad breath or rotting teeth. Then I made the mistake of asking what the worst case was for her. She told me about a time that a woman came in with pretty much all of her teeth completely rotten and an abscess on the back of her mouth. The dentist apparently started working on the back of the mouth and popped the thing. She described the smell as that of a dead animal. Apparently the smell was so bad that it permeated the thin mouth cover and the abscess had popped with such force that some of the pus landed on her shirt. I think of that story every time someone tells me I should do interpreting at hospitals. Story 22. Wife is a trauma surgeon. She's sleeping now, but I get about an hour every night where she unloads the horrible she sees. One that sticks out is the girl and her boyfriend on the motorcycle. They were taking a sort of underground turn from one highway to the next, and he was going way too fast. He started to get close to the wall, so the girlfriend on the back decides, best idea, go ahead and put your foot up on the wall of the tunnel. Foot catches the wall, she flies off. Leg breaks at the femur, and the broken bottom half of her leg drives straight into her. She gets a middle-aged male in for stomach pains. Says he was at a party, got drunk, woke up at another party and hasn't been able to deuce in a few days. Tox screen comes back positive for amphetamines, cocaine, and weed, so a good night out. CT scan comes back with one full-size Glade air freshener, can totally up this guy's bottom first. It is so far up that the colon has collapsed around it at the anus and created a vacuum behind it. They try a number of ways to get it out with no luck. Finally, she gives him a paralytic because his beehole keeps fighting back, and my wife is now double-fisted up this guy's. There is a picture of her holding the can somewhere out there. This is the second aerosol can she has removed from the of someone in town. First one was a full-size spray paint can. The man bought the can at Lowe's, placed it in the bag, and inserted it with the handles of the bag hanging out, his thinking he could just use the plastic bag handles to pull it out. He broke the handles trying to pull it out. The bag still had the receipt in it. Lots of dog attack stories. Recent one is 8-year-old boy attacked by 3 PBs with more than 100 puncture wounds. 7 PB attacks this week, only 1 provoked. In accordance with the Reddit circle party around here, they are not the most aggressive dog. They are, however, the dog most likely to cause injury or death during an attack by a wide margin. I'd have to get her on here to really do this justice, but with her schedule, not likely. Story 23. A bit late to the party, but here is my contribution. I have some nasty pus stories, but I think the top post wins hands down in that category, so here is something a bit different. Just a couple of months ago, actually. Woman about 35 years old comes in for a pap smear. Okay, no problem. Put the speculum in and maneuver it around a little bit to find the cervix, and I see something dark brown in the right lateral fornix. My first thought was, oh, cancer. You see, when I was an intern, I had a patient on whom I found very dark, friable tissue on the posterior wall of the upper vagina, which eventually turned out to be rectal cancer that had spread into the vaginal wall and was quite advanced. You know, one of those patients you kind of never forget. Anyway, I try and gently scrape at this dark brown area to get a feel of what it was when the smell hit me. I imagine if death itself died and rotted for a few weeks, that is what it would smell like. My medical assistant scooted away to the edge of the room. Poor thing couldn't leave the room as she was my chaperone. I stopped breathing through my nose and started to breathe only a couple of times a minute from my mouth, of course turning my head away from the source of the smell to take a breath. Anyway, maneuvering the speculum a bit more and scraping a bit at the brown area some more revealed an answer to the mystery. It was a cylindrical, thick wad of something. An old tampon. The patient had no idea that it was there, and her period had ended over a week ago. So this thing had been there for over a week, and the lady was walking around living life as usual. Thankfully, she did not get TSS. Retrieval of the tampon was uneventful, and the lady was sent home with advice on being more careful with remembering to take out tampons, or perhaps consider switching to pads instead. Story 24. Not a doctor, but a nurse. Was working in emergency for first 5 years of my career. Old guy about 80 presents. Foreign body in his butt. Turns out to be a war vet. And had a live shell about the size of a slim Coke can up his probably about 9 long. He was very stoic. However, we had to call Australia's version of the bomb squad to assist in the removal. Exciting days. Poor, lonely old guy. Tell da are so artillery much insertion. Edit. Grammar, of course. Story 25. Paramedic here. Back when I was a rookie, we ran a call to assist the police with an injured person. Get on scene to 5 to 6 cops and a large naked man in cuffs sitting on the curb. In the middle of February in the Mid-Atlantic region. Check the guy out while talking to the cops. Apparently, he had decided to smoke some PCP and the cops ended up having to tase him. The part of the story you've been waiting for. One taser barb in the umbilicus and the other in the head of his penis. TLDR. PCP leads to a new penis piercing courtesy of the police. Story 26. Doctor here. When I was working in the ER one evening, I had my worst experience so far. I was called to one of the examination rooms that are designated for infectious patients. This is already a bad sign as it usually involves some sort of abscess that needs to be drained. However, this time it was far worse. I was told by the nurse that it involved a man who had bilateral venous ulcers on his legs and that they were now infected. I looked through his journal and saw that he last saw a doctor about 10 months earlier and no note of any checkups after, not by a nurse or a GP. Therefore, I asked my nurse when someone last took a look at his legs, not since his last journal entry. Then I asked when was the last time he changed his dressings on the legs. He hasn't. Some background info on the patient. Old man who lived by himself in his trailer that was parked in the middle of the forest. He had no running water. He was a bit of a drinker and a general, I don't give a, or mentality. Awesome. Suited up and went into the room. The room smelled like an odd combination of stale beer, mold, and disease. Certain infections smelled different, and this one was very pungent, almost sulfuric. I introduced myself to the patient who didn't understand what the he was doing there. All he wanted was some antibiotics for a flu, and then he was sent here. Why the do you want to look at my legs for? They were already taken care of last year. Great. So we started unfolding the dressing. They were crusty and crackled as we unwrapped the first leg. As we got deeper, it changed color to some sickly yellow, and the stench became worse and worse. One of my nurses left the room to throw up. Then I saw it. Very small, but inside a fold there was a little maggot who squirmed. Fuck. When we finally got to the wound, we saw all the little maggots feasting on this man. There must have been 50 of them. The stench was absurd. I was focusing a lot to breathe through my mouth, but then it felt like I could taste, which made it even worse. My nurse came back and promptly went out again. I unwrapped his other leg and same story there, but the infection was much deeper, and I could see a few tendons on the base of the ulcer. Absolutely delicious. We had to clean of the maggots and place them in a bowl, but they were squirming and went on the floor and crawled all over the place. I had to watch my feet so I didn't step on them. After that, we took the patient to hose him down to at least try to get rid of some of the smell. Then booked to the OR for debridement and a fresh vacuum dressing. Discharged a few days later with strict instructions and booked him in to return for redressings and checkups. Then we never heard from him again. TLDR. Maggots. Lots of maggots. Story 27. My uncle told me this one. He was doing rounds at a prison hospital. This one guy came in with a massive infection where his colostomy bag connects. Turns out he had been selling that hole for sexual use. Story 28 med student here. I've seen some pretty nasty stuff, but the best stories come courtesy of my parents who are both doctors. Early in my mom's training, an old man presented to the ED. On examination, his feet were incredibly gangrenous. My mom sets out to manage his various issues and decides that soaking the man's rotten feet before dressing them is the best course of action. So she gets a basin of warm water and leaves them to soak while she goes about her other work as a junior doctor. She returns half an hour later to find 10 little piggies floating around in the basin. My dad's story occurred while we were living in Scotland in the early 90s. It was a particularly sunny day by Scottish standards, and one of the rare days you might be able to get a tan. The Scots are not known for their ability to tan, and the typical Celtic Scots less so. Wiry red hair and pale white skin. However, one such Celt was rather overzealous and decided he would really go for it on this day in question. He cracked out several sheets of tin foil and basted himself in cooking oil. Needless to say, he pitched up to the ED a few hours later. Third-degree burns all over his body. Story 29. Token. Not a doctor, but I am a nurse and I have a story. I was working in the emergency department one afternoon and we had an elderly lady just calling out, help me, repeatedly. All afternoon, she was bought in by her nursing home for agitation, which is normally code for they can't handle them anymore. So the PT was placed with a carer assistant to try and calm her down and make sure she didn't wander around the ward. The carer was helping to feed the PT, and I walked past when suddenly the lady just breathed her liquid diet in and collapsed backwards. I, of course, instantly pushed the med-emergency button and everyone comes running from all over. We assess her airway and it's deemed clear but not self-supporting. No food in there, which was strange. She wasn't breathing, and no heartbeat was present. So one of the male nurses starts compressing on her chest while another nurse tries to insert an airway. As he compressed on her chest, a literal fountain of murky green goo spurted from her mouth. All over the walls, ceiling, medical staff, literally everywhere. And of course, we are all like, what the hell is this shit? And the poor male nurse had to keep compressing the chest while the other nurse kept trying to suction the patient's airway to clear it enough to insert an airway. After 5 or 6 minutes, the nurse finally gets the airway in, after suctioning over 6L of this goo, and after some defib, the doctor declared the patient dead. The bay and the surroundings, say 5 or 6 meters, was just drenched in this slimy, murky brown-green mess. It was absolutely breathtakingly disgusting. Eventually, we found out the poor old lady had a massive bowel obstruction, had a cardiac arrest while eating, and the goo was days and days of liquid fecal matter. Safe to say, I scrubbed myself raw in the shower that night.